Premiums for Singapore's universal healthcare insurance are set to rise by up to 35%. The annual claim limit will also be raised by half to 150,000. The changes are among recommendations by the MediShield Life Council in its first major review of the scheme. At the same time, the government says it has set aside about $2.2 billion over the next 3 years to help Singaporeans afford the premiums, especially the elderly and lower income residents. Premiums are set to go up across the board by more than 10%, while those aged 61 and above will see the biggest jumps of around 35%. To cushion the initial impact of the increases, the Health Ministry will provide a one-off COVID-19 subsidy, covering 70% of the net increase in the first year and 30% in the second year. For Singaporeans, this means a net premium increase of about 10% in the first year. With the higher premiums come enhanced benefits, such as a higher annual claim limit of 150,000 to help those who need extended or multiple hospital stays. New treatment-specific claim limits will also help those requiring additional care at community hospitals or expensive outpatient radiotherapy for cancer. Other changes intended to reduce hospitalization bills include an increase in claim limits for the first 2 days of acute hospital stay and a lower deductible for day surgeries for patients above 80. The proration factor for private hospitals will also drop to 25% to ensure more equitable payouts between subsidized and private patients. The MediShield Life Council will hold a public consultation on the proposed changes from Tuesday to the 20th of October. As part of the MediShield Life review, the scheme might also cover treatment for drug addiction and alcoholism. At the moment, claims for treatment arising from attempted suicide, intentional self-injury, drug addiction and alcoholism are excluded. The Council has proposed removing the standard exclusions in recognition of the increasingly important role of treatment in the recovery process. The move is welcomed by doctors, who say costs can add up, especially for those requiring long-term treatment. It may also help shift perceptions of these patients.
Cost is always a factor in whether or not someone comes for treatment and continues treatment. And in Singapore, as you know, we have a bit of a criminal model for drug addictions. Yeah, so people may tend to go underground instead. But if they can actually use the funds to pay for it, then that would be great. It would send a strong signal to the public that we should really be looking beyond stigma of mental health. Yeah, and it would encourage people to come forward to seek help.